Good afternoon. Thank you for joining us for this media briefing. Today we have with us Dr. Hanan Balkhi, the WHO Regional Director for the Eastern Mediterranean, and Dr. Latifa Ibou Abdellawi, Director General of the Islamic Center for Development of Trade. We will begin this press briefing with statements from Dr. Hanan and Dr. Latifa, and then we will open up the floor to journalists' questions. We're live streaming this press briefing on X as well as Facebook, LinkedIn, and YouTube. And Dr. Hanan is also broadcasting on her X account live. Journalists who join live will be able to pose their questions after unmuting, and we would request them to kindly share their name and outlet once we give them the floor. So over to you, Dr. Hanan.
Thank you, Tamer, and welcome everyone, and welcome to Dr. Latifa as well. Ladies and gentlemen, member states and dear members of the media, thank you for joining us today for the high-level Islamic financing roundtable ahead of the high-level Islamic financing roundtable in Riyadh. Today's briefing offers the context needed to report on a rapidly emerging opportunity to expand fiscal space for global health. Health systems worldwide face mounting strain, tighter budgets, rising demand, fragmented services, and a 40% decline in external aid. In the Eastern Mediterranean, these pressures are intensified by protracted emergencies, a growing non-communicable disease burden, large refugee population, and high out-of-pocket spending. Across our region, the wider Organization of Islamic Cooperation, also known as OIC, community health needs are increasing faster, and traditional financing cannot keep pace. This makes innovation, sustainable financing models essential to complement domestic budgets and offset dwindling external support. Islamic finance offers one of the most promising opportunities to help close this gap. Its wide range of instruments such as zakat, waqf, sadaqat, khums, sukuk, and takaful are grounded in solidarity, fairness, and shared responsibility. While they have long supported social welfare, their potential for global health remains underused. We already see examples of Islamic social finance supporting health services, subsidizing treatment, and strengthening community health. Zakat funds in Sudan subsidize national health insurance for low-income households. Kuwait's Zakat House finances health projects in Yemen and Lebanon, and Qatar's charity program have reached more than 32 countries. In Saudi Arabia, a recent study identified 4,381 waqf endowments supporting SDG 3 health, representing 12% of the SDG-aligned waqf spending. Of these, 44% for specialized care, 31% for primary care, and 26% for prevention and public health. Multilateral development banks are also recognizing Islamic finance as a tool for closing health gaps. The $2.5 billion Lives and Livelihoods Fund blends grants with concessional Islamic financing to expand primary health care and infectious disease control in low-income member states. Building on these achievements, we aim to strengthen and scale the link between Islamic finance and health sector needs by identifying effective models, helping governments structure investable health projects, mobilizing ethical and predictable capital for primary healthcare, universal health coverage, and disease eradication, and promoting cross-regional learning. Tomorrow's roundtable will bring together ministers of finance and health leaders from Islamic Development Bank and other organizations, OIC, philanthropies, private sector investors, and experts from across the region in Africa. It will also from across our region and from the African region. It will also introduce the vision of new coalition of Islamic financing for global health, co-led by WHO and the Islamic Center for Development, ICDT, an effort to turn Islamic financing into a practical mechanism that countries can readily use to close health financial gaps. Digital payments, fintech systems, blockchain-based transparency platforms, and AI-supported analytics are creating new ways to ensure that every rial or dollar or dirham is tracked, compliant, and linked to measurable health results. Today's briefing will outline this landscape, the challenges we face, and why Islamic finance is rapidly gaining attention as a strategic solution for global health. Thank you very much, and back over to you.
Thank you, Dr. Hanan, for the statement. Dr. Latifa, over to you for your opening.
Thank you, Mr. Tamir. Good morning, good afternoon, everyone. Thank you for joining today's online press briefing. Today's briefing is intended to highlight the strategic direction of the discussion that will take place tomorrow on Islamic financial for global health. At the outset, I would like to underline the importance of our partnership with World Health Organization. This collaboration reflects a shared understanding that strong health systems require not only public policy, but also sustainable investment framework and effective engagement with the private sector. I would also like to express our sincere appreciation to Dr. Hanan Balkhi, WHO Regional Director for Eastern Mediterranean. We are grateful for her strong partnership, her commitment to innovation, and her leadership in advancing integrated approaches that link health priorities with economic and financial strategies. Her engagement has been active in shaping this initiative. The key message of this briefing is simple. Health is not only a social priority, it is a strategic investment and trade sector. The challenge today is not the absence of capital. It is the need for bankable projects, predictable policies, and coordinated funding and investment frameworks. In this context, Islamic finance is a critical enabler. It is not a niche or alternative model, but a mature investment framework that operates in line with international standards of governance, risk management, and profitability. When the right conditions are in place, it can support long-term investment, public-private partnership, and trade-related value chains in the health sectors. Health also offers significant opportunities for local production, regional trade, and cross-border investment, in particular in pharmaceutical, medical equipment, logistics, and digital health services. Tomorrow's high-level roundtable will focus on how to better connect health policies with investment promotion and trade facilitation, and how to move from fragmented initiative to scalable, investor-ready solution. Today's message is therefore clear. Partnership, coordination, and investment willingness are essential. By working closely with WHO and other partners, and by leveraging Islamic finance, we can translate health priorities into concrete investment flows and sustainable economic impacts. Thank you for your attention, and we look forward to the discussion ahead. Thank you.
Thank you very much, Dr. Latifa, for your opening remarks. Moving on to the questions from the journalists, we have Mustafa Haggag from Akhir al-Anba, Dr. Hanan. He asks, how can low and middle income countries in the Eastern Mediterranean region make practical use of Islamic financing tools such as zakat, waqf, and sukuk to bridge funding gaps in primary healthcare and universal health coverage?
Thank you, Mr. Al-Hajjaj, for this question. Of course, as we mentioned, both and my colleague, Dr. Latifa, this is ahead of tomorrow's roundtable discussion, and we're going to be learning a whole lot more about this topic, of course. But what we can say very clearly is that from our understanding and engagement with our member states for decades now, we do see that there is a huge need. We have significant fragility in our region. We have extreme numbers of very high out-of-pocket expenditure, which means that the people of some of our member states are actually having to make a choice between health and education, health and livelihoods. It becomes a huge burden on our member states. So I think it is a really good time for us to tap into this potential of directing and using some of these Islamic financing mechanisms to support such member states. So what have we been facing so far? Of course, and we're going to go through this journey together, is that we realize that it has not been used enough and has not been tapped into enough to make the best out of such of these opportunities. We have very outdated legal frameworks, for example. There is insufficiency linked to national health financing strategies. There is sometimes a gap in the understanding of how can these financial tools be utilized for the betterment of the people and for supporting the health agendas, and specifically when it comes to equity and how to direct this funding and where can it go, and also to have a body and an entity such as the WHO and other advising agencies, the World Bank and other development banks and other UN agencies with specific knowledge on specific areas. How can that money be and funding be tapped into? How can it be utilized, and what is the best investment for such money? And I think also it will allow us to dive a little bit further into the private philanthropy that are also keen to support such initiatives, especially when we see that the inequity, the lack of solidarity is only growing bigger and bigger. So I think those are some of the potential ways to try to bridge some of those major gaps.
Thank you, Dr. Hanan. So journalists are also keen to understand the nature of the partnership between both WHO and the Islamic Center. So Dr. Latifa, we have a question from Mona Eid from Al Ahram newspaper. She asks, what role would the Islamic Center for Trade Development play in the new Alliance for Financing for Global Health?
Thank you, Mr. Samir, and thank you to Mona for this very important question. Before responding to your question, I would like to give a brief presentation of ICDT. We are a subsidiary organ of OIC, Organization of Islamic Cooperation. This is the second bigger international organization in the world after United Nations. Our mission is to promote trade and investment among our member states. And our mission is really to create value added to support people, to support government, to support also private sector. In this project, we will act as a catalyst and convener, bringing together OIC member states, authorities in OIC member states, private investors, development finance institutions, and also philanthropic actors around a shared vision for promoting trade and investments in health sector. In this regard, we will elaborate sectoral and value chain analysis, identifying priority health subsectors, investment gaps, and bankable opportunities in pharmaceutical production, medical supplies, digital health, digitalization, and health infrastructure. The center also will support and accompany private sector operators, in particular SMEs and strategic investors by facilitating contact with authorities, facilitating market access, partnership, and alignment with Islamic finance instruments and development priorities. ICDT will also promote trade and investment in health value chains, support South-South cooperation, since we are a South-South organization, and facilitate developing integrated and regional platform to ensure that financial inflows translate into tangible economic, social, and health outcomes across OIC countries. In brief, ICDT will serve as a strategic bridge between policy, finance institution, private sector engagement, and on-the-ground implementation. We will contribute in accelerated resource mobilization, enhancing investment promotion, and strengthening sustainable economic development of health sector in our region.
Thank you, Dr. Latifa. And of course, journalists are also conscious, Dr. Hanan, of the challenges we've been facing in the past year as an organization. So Amal Alam from Al-Yawm Al-Saba is asking, can Islamic finance fill the funding gap created by withdrawal of the United States from the WHO?
Thank you for that question. And again, I think this has been the most critical question we've been asked about over and over again. I just want to maybe just take a moment to appreciate the leadership of the United States and what they have provided as a major member state within the WHO multilateralism within health and their leadership. And we do really hope that they will reconsider returning to the WHO. But I think we've already been working quite hard to diversify the resources. And since 2017, also under the leadership of Dr. Tedros, there has been towards increasing the flexible funding, or we call the assessed contribution from the member states, to be about 50% of our funding. Right now, it's only 20%. So the member states, and a huge thanks to the member states who have agreed to an incremental increase over the next 3 biennia to reach to that level of funding security for the WHO, which is very crucial for us. It also made us think even stronger on the diversification of the resources of funding, whether for the WHO or for the member states to become more and more independent, and for them to have a broader fiscal space for budgeting and supporting and funding their health agenda, and also to decrease their reliance on external funders, and for them not to fall into this situation which makes certain health services suddenly collapse, which has been the case. And it worries us a lot because that has also allowed for hundreds of clinics to shut down and people unable to reach their proper healthcare. So I think Islamic financing offers us many things, but let me just highlight a few. First of all, the Islamic financing under the Islamic faith is a faith of mercy, solidarity, compassion, and caring for others. And in fact, zakat is one of the 5 pillars of the religion of Islam. So it taps into that solidarity of hundreds of millions of Muslims in our region and beyond who really care about this issue, whether through zakat or awqaf, or the tools that are rooted in this sense of shared responsibility and care for the vulnerable. So that's why it's a bit exciting for us to lead on this area of work. The second issue is that it helps us unlock new, perhaps more predictable resources for specific areas that will ensure equity for the people of the region and beyond, which is primary healthcare, universal health coverage, and also to be able to support the countries that are facing the most critical of the crises and extremely tightening fiscal space that has already been challenged. And third of all, it helps us, as I mentioned earlier, to diversify our funding and financing base so that we can reduce the dependency on whether it's for the WHO, but more so for the member states, to reduce dependency on aid and put in place solutions that can be sustained from within the country. And lastly, it allows us to identify ways that will ensure the diaspora, which are a large group of philanthropists and wealthy individuals from this region, who can find good methods to support the people in securing their health and well-being. So I think those are some of the potentials. But again, the wider our donor base, the better for all of us.
Thank you, Dr. Hanan, and quite an exciting prospect as well to have this wide base of funding. But the journalists are also conscious, Dr. Latifa, that Islamic financing might have its own rules and regulations and areas where it would be possible to make such funding. So a man from Al Wafd newspaper is asking what health programs are allowed to be funded according to modes of Islamic financing, and which other areas of work might not be as equally possible to be funded through this modality.
Thank you, Mr. Tamer, for this question. But before responding, I would like to highlight the important role of the private sector in in this area and for this project. The engagement of the private sector is critical to the development for all economic sector, including, of course, the health sector. To attract private operators to invest in given sectors required an investment climate aligned with international standards. These include an appropriate regulatory framework, transparency, the availability of qualified human resources, access to national and international markets, and access to appropriate financial mechanisms. And in this context, Islamic finance can serve as a highly effective and complementary solution to mobilize private investment. And for this reason, targeted promotion and capacity building programs for both host country authorities and also potential investors are crucial. And this is precisely the approach what we are determined to follow. Now, which sector and which industry will beneficie or use Islamic finance. Islamic finance follows the same economic principle and profitability requirements as other forms of finance, although within specific regulatory ethical framework. It is not based on a rigid list of inclusion or exclusion, but rather on its own regulatory principle, while fully adhering to the economic and prudential standards observed by all financial institutions. And as such, health sector projects are fully eligible for Islamic financing, provided that the necessary regulatory and economic prerequisites are in place.
Thank you, Dr. Latifa. And this is great news because it shows a lot of flexibility in terms of Islamic financing to fund health programs. So I guess this takes us to the question from Mona Eid from Al-Ahram. She asks, what are the most important priority health areas that WHO plans to use to support through Islamic financing tools?
Thank you, Mona, for that question. And I think the priorities always need to come from the member states. So it is really what are the needs of the member states? And of course, being very close to our member states, and we do have 21 country offices in our member states of this region, as we do with many other regions as well. So our presence with our member states allows us to understand how to better customize and develop these financial instruments with them. And also there's been a lot of other work in the broader term of financing and understanding how to develop the finance matrix, how to identify smarter purchasing mechanisms, how to create pooled funding mechanisms. So then the piece of the Islamic funding will be complementary to the overall work that we already do with our member states when it comes to the area of financing. Now, the areas that are in most need in our region have also been articulated very well in our regional strategic operational plan, which we developed together with our member states, and it was approved in our regional committee of 2 years ago in 2024, and also in establishing 3 major flagships that helps catalyze the health agenda for our member states. So very easily it will help build capacity and independence from for the member states in ensuring that their people and everybody living on their lands have equitable access to affordable and effective medications and medical products, and that goes under support of the different elements within the first flagship, which is the access flagship. It will also enable us to look into mechanisms to support education to regain the need for the health workforce. The Eastern Mediterranean region of 750 million people accounts for 10% of the global community. However, 20% of the health workforce shortage is within our region. So you can imagine the burden of the migration outwards from this region, from the health workforce, how much it has affected the capacity of primary healthcare and the healthcare provision. And the second flagship that we had on top of the other health agendas is we're hoping that this will help, and this is a big priority for the members and the people of this region, is how do we mitigate the public health challenge of drug addiction, substance use, and mental health. So I'm looking forward to engaging in further discussions to identify ways so that ourselves and our partnering UN agencies, specifically UNODC. How are we going to capitalize on this momentum to put in place the tools needed by our member states to address the issue of addiction, substance use, mental health, but also all of the other areas? So there's a huge potential for this type of financing to push forward the agenda of the member states, and with us supporting them. As we say, the member states identify and we align and partner.
Thank you, Dr. Hanan. So a lot of areas of work, a lot of potential, a lot of opportunities. Dr. Latifa, in this case, I guess the funding from Islamic financing needs to be well aligned and to be able to support all these areas of work. Mustafa Haggag from Akhir al-Anba asks, what mechanisms are proposed to ensure that Islamic funding moves from the level of fragmented initiatives to a coordinated institutional framework that OIC member states, those are member states of the Organization of Islamic Cooperation, can easily and effectively apply in funding public health programs?
Thank you, Mr. Mustafa Hajjaj, for this very important question. And I would like to express that I 100% align what just said by Dr. Hanan. We are here to address the needs reflected by our member states and in partnership with all partners in this area. Related to your question, I would like first to comment the remarkable work already undertaken by Islamic financial institutions and development partners in supporting health and social development across OIC member states. Already there is many programs, many projects that are benefiting from Islamic finance in our region, in Africa, in South Asia, and all OIC member states. And what we are looking for is to build on this solid foundation, and the objective is to encourage more and more use of existing Islamic finance instruments by investors and project sponsors. Why we will do that? In our view, we need to promote awareness about this new mechanism, to share successful experiences that exist, and also to facilitate connection through regional platforms. And our objective is to create an enabling environment where investors are encouraged to consider Islamic financing solution for health-related projects in line with national priorities and institutional framework. And at ICDT, in all our projects, for trade facilitation, for trade promotion, or for investment promotion, we highlight the importance of involving using Islamic finance. And this, what we are doing is for both parties. We are promoting Islamic finance because this is a very important sector in our region, and the opportunities to invest are huge. And also we are supporting companies, enterprises, and also government to catch the huge potential of funding that present financial institution, Islamic financial institution.
Thank you very much, Dr. Latifa. So a lot of opportunity there. But also journalists want to know what has already happened in this area of work. Islamic financing is something that perhaps has been followed for decades, maybe centuries. So Mona Eid from Al-Haram asks, are there successful examples or examples of success that can be built upon in using zakat or waqf to finance health programs?
Thank you very much. And I think this is a very valid question. And those of us in these communities know that the support of, even though now it's turning, it sounds more like an academic endeavor. In fact, for 1400 years, the use of money and funding to support the health of the people has been ongoing. But there are more concrete examples for zakat, for example. We have a global initiative such as the UNHCR Refugee Zakat Fund, and that has reached hundreds and thousands of vulnerable people across more than 20 countries with essential health and social support. And at the national level, countries like Sudan, for example, have also used domestic zakat to cover health insurance contributions for poor families, and an approach that has also fully aligned with the zakat principles directly to improve the actual access to care. But in high-income countries, we have Kuwait and Qatar, zakat and sadaqah have been used to fund health projects across the region, demonstrating very strong cross-border solidarity. And there's also partnerships with local zakat authorities, as UNDP has done with Basnas in Indonesia, where they show the potential for aligning the domestic zakat with national health priorities and even with sustainable development goals. And maybe finally, there was a strong example of Waqf supporting health, and that was in the Kingdom of Saudi Arabia, where more than 4,000 health-related endowments contribute to serving services ranging from primary health care to specialized treatment and public health promotion, as I had mentioned in my opening statement. But Oman has Athar Endowment Foundation, is another promising model. So there are a lot of models, and what we would like to do is we would like to bring them all together in that roundtable discussion tomorrow. And we need to dive deeper into what have been the challenges, how have they been solved, and how are we going to solidify these major opportunities for the betterment of the people.
Thank you very much, Dr. Hanan. And Dr. Latif, I guess appropriately as the last question for this press briefing, Mona Eid from Al Ahram follows up by asking, what are the next steps following this media briefing and the forum in Riyadh?
Thank you, Mona. The round table in Riyadh that will be held tomorrow, inshallah, is intended at a starting point. Its ambition is to convene and align key stakeholders around a shared objectives, which is advancing the development of the health sector through Islamic finance. This is fully consistent with ICD's core mandate to promote Islamic finance and to support priority sectors, particularly health, across our member states, in line with priorities identified by member states. The valuable participation of our partners in this roundtable will contribute to the formulation of a concrete and impactful action plan or framework, enabling a coordination and results-oriented follow-up. Tomorrow's high-level roundtable will focus on how to better connect health policies with investment promotion and trade facilitation and investment promotion, and how to move from fragmented initiative to scalable investor-ready solution.
Thank you very much, Dr. Latifa. So a lot of hopefully successful initiatives to look forward to, and I'm sure colleagues in the media sphere would be keen to know the outcome of these activities. Dr. Hanan Balkhi, thank you very much. Dr. Latifa Abdullawi, thank you very much for joining us, and wishing all colleagues online a good day.
Thank you very much. See you tomorrow.
Thank you. Thank you so much. Thank you so much. See you tomorrow. Thank you.
Inshallah.